made a difference in so many people's lives. She has worked very hard at making a difference. She is the Director of Innovations at ECHO. She's also an educator at the University of South Carolina. She has done so much in her career, and she continues to focus on just wanting to make a difference. If you ask her a question, I can tell you she will give you an answer, and she is extremely knowledgeable on a variety of different things. She's done some incredible things in our community and throughout the state. Not originally from Myrtle Beach, but I tell you, she is a community member because she continues to make a difference here and in Myrtle Beach. She's originally from Lake City, and she's going to tell you a little bit about herself throughout tonight and a lot more, and I'm very excited to introduce her. So without further ado, Dr. Ann Gowdy.
And I will tell you, I'm happy to be here, and I'm here because of prevention, and from my family, my local community, all providing support and investing in me, and I'm very thankful for that. So we are going to get things started tonight. As we have each panelist come up on the stage, I will share a brief bio. Please get ready because we've got quite a few degrees coming up, and it should be warming up the room for us. So first up, we would like to welcome Michelle Smith. She is originally from Bethel, Connecticut, and she came to this area in 2004. She graduated from Coastal Carolina University with a major in sociology, a concentration in criminology, and received the Sociology Department's Outstanding Student Achievement Award. She has worked in the Horry County Solicitor's Office and their interventions program for, 11 years, long time. Most recently as a senior case manager for their pretrial intervention. She recently joined the city of Myrtle Beach as the opioid program coordinator in November 2002. Welcome, Michelle. Glad to have you this evening. Next up, we have Bruce Lynch. He is a licensed professional counselor, a supervisor, and a licensed addiction counselor supervisor with the Center for Counseling and Wellness in Horry County. He obtained his BS. Yeah, I went for a BA, so I didn't have BS behind my name, but in psychology from the College of Charleston, and he later graduated with honors from Webster University with a master's in counseling. He is currently the ED for the center, and his aspiration is to assist the community, hometown, to achieve greater overall wellness through therapeutic counseling work with individuals and families and couples. Welcome, Bruce. Glad to have you. All right. Side note, I'm starting with the names that All right. Next up, we have Tanya Menine, a fellow colleague and social worker. She is a licensed independent social worker. She is the director of Integrated Healthcare Services at Little River Medical Center, and that also includes the Ryan White and Behavioral Health Services. Little River Medical has locations throughout Horry County. Prior to coming here in 2016, Tanya worked at another federally qualified health center in New York and has a depth of experience with brief, evidence-based behavioral health interventions for patients of all ages, addressing the whole person, not just a piece of the problem. Whole health is important to her. She has over 20 years of experience and has a passion for working with individuals who have been affected and who are at risk for HIV and AIDS, hepatitis C, and substance use. Welcome, Tanya. Glad to have you this evening. Next up, we have Scott Palmictor. Did I get that right, Scott?
Right.
Thank you. All right. Scott is a clinical social worker. Good to meet you, another colleague, with 15 years with experience. He has worked with children, adolescents, and families or adults with behavioral health challenges. He received his master's degree from Marywood University in Scranton, Pennsylvania. You know, we have a Scranton here in South Carolina too. And he is currently employed at Grand Strand Medical Center Behavioral Health. In his free time, he loves spending time with his family and his children. Welcome, glad to have you, Scott. Next up, I think a lot of us know Sashi. Sashi is a Mental Health Alliance partner with the Myrtle Beach Police Department. Prior to being with the police department, she's worked with Waccamaw Mental Health Center for almost 10 years. For her, it is an honor and a pleasure to be in such a pioneering partnership with the city of Myrtle Beach. Welcome, Sashi. Next up, we have Carol McCall. Carol came to the Housing Authority of Myrtle Beach in 2000. So that's, what, 23 years you've been with the Housing Authority. Wow. She came to us from Massachusetts, where she spent 6 years managing multifamily housing. She's currently the operations director, and her responsibilities include grant writing and management, project development, and keeping the computers running. That seems like a full-time job. She's also known for a listening ear, extreme patience, and she also is a member of the Ebenezer United Methodist Church. Welcome, Carol. Next up, we have Kathy Buell. Now, Kathy, I must admit, practicing announcing, I wanted to keep saying from, remember the movie? Bueller. Awesome. Welcome, Kathy. She is the director of the Beacon Lighthouse Behavioral Health Hospital's intensive outpatient program. Kathy completed her undergraduate degree at Douglas College for Women and at Rutgers University in New Jersey. She received her Master's of Science in Counseling Psychology from Chestnut Hill University in Philadelphia, and she is licensed in the field of addiction and has over 33 years of experience working with patients to treat substance use disorders and mental health. Welcome, Kathy. Next up, we have Tina Narden. Tina is a licensed professional counselor and a national certified counselor. She received her bachelor's degree in psychology at Ohio University and a master's degree in professional counseling at Carlow University in Pittsburgh, Pennsylvania. As a licensed professional counselor, she has worked in counseling services at Coastal Carolina University and currently works as the Assistant Director of Substance Use Education and Services. She primarily provides assistance with substance use assessments and educating students who are violating the alcohol and drug conduct policy. Welcome, Tina. We are glad to have you. Next up, we have Zach Cluse. Zach, am I saying it right? Cluse? Cluse, great. Zach is a Myrtle Beach native. He joined the military after high school. He went into corrections at J. Reuben Long Detention Center. He has been employed with the Myrtle Beach Police Department for 6 years and has worked as a school resource officer for 2 years at Myrtle Beach High. Welcome, Zach. And we will welcome our last panelist to the stage, Jessie Marlowe. She is the Director of Public Relations and Prevention Services at Shoreline Behavioral Health Services. She supervises a Department of Prevention staff and interns, along with marketing and media activities for Shoreline. She is a graduate of Coastal Carolina Universities with a bachelor's degree in health promotion, and she received a master's in business administration from Louisiana State University, Shreveport. Go Bulldogs. That's Georgia Bulldogs. She has been in the field for over 14 years and is a certified senior prevention specialist. She serves as the Behavioral Health Services Association Prevention Committee and created the Horry County CAST Coalition. What does CAST stand for?
Community Action for Safer Tomorrow.
Great, thank you. Welcome, Jessie. Glad to have you. So in getting started, we've heard the word prevention a lot, right? And there are many different definitions. If you Google prevention, you're going to see a lot that comes up. So we just want to touch on a couple of the highlights for what is prevention. So prevention activities are really working to educate and support folks in our communities to prevent the using and misuse of drugs and alcohol and the development of substance use disorders. With that, that means crossing over into the level of what we'll hear from our panelists, which is clinical impairment. For mental health promotion is about encouraging and focusing on protective factors and healthy behaviors that we have by strengthening those and trying to cut down and address risk factors that may come up. And we'll hear some more from our panelists on that this evening. Homelessness, I know tonight we have a focus of youth. So what I would like to share is for preventing of our youth experiencing homelessness, it is really about focusing on intervention with families, strengthening families, and being able to provide supports of caring adults that can help them through navigating whatever issues may be coming up. Involvement in foster care, the juvenile justice system, our LGBTQ plus youth are all youth that are at a higher risk. All right, so now that we've briefly touched on prevention, we are going to move to our first question of the evening, and I'm going to open this up to whomever would like to start. Drugs and alcohol are prevalent in Horry County, with alcohol, vaping, and marijuana use common among teens. What substance use prevention services does your organization offer? All right, Tanya, you got the microphone. Everybody else was looking away or down. So you want to start us off, Tanya?
So I'm from a federally qualified health center. So no? There. Is that better?
Can
Okay.
y'all hear in the back of the room?
Can hear you.
Okay. So we work with our pediatric patients. So usually we start working with our parents, with our newborns, screening for depression, anxiety. We also screen to get an idea about their substance use. But definitely by the age of 12, we are meeting with all of our patients without their parent guardian in the room. And that's where we ask from bicycle helmets to seat belts. And then we'll ask about, hey, have you ever tried tobacco use? Not just smoking or vaping, but actual tobacco use. We find that there's many young adults and youth who are dipping. And then we'll really start educating them about the risks, because in our world, when you just shared the definition of prevention, in healthcare, prevention is about preventing disease, disability, and death. And so we have an easier job than others because we just normalize it in overall healthcare.
Tanya, real quick, so you said a specific age, 12. Can you help us understand why you start asking and what that means if a young person starts using and trying substances at that age?
Yeah, so we do adolescent behavioral health screenings is what we call it. And so we just want to start asking not only about substance use, but for us, we'll talk about anxiety. And I'm sure all of us up here, we meet young people who are starting to experience some anxiety, boredom. Boredom is the number one reason kids will tell us they tried, using alcohol from the parents because they just want to see what it feels or to escape the reality of their lives. And so we just really start inquiring, but then educating. how is this affecting you? Like, okay, so you only took a couple of sips. We ask them what they know about family history. And we really encourage families to disclose any substance use disorders and why that places them at a higher risk.
Great. All right, who else would like to add and address drug and alcohol use prevalence here in Horry County with teens and what your organization and services are offering?
I definitely do. I am the prevention director. She already told you that, but we have a department of 8 staff who do prevention services in Horry County, and they focus on drug and alcohol use so that we can basically reduce the chances that someone develops a substance use disorder in the future. Our reason that we would choose the age of a 12-year-old is because that's the average age of first use for youth in Horry County to try alcohol and tobacco products. So with that being said, some of the programs that we offer, we have several grants in our department. One of the grants works to reduce opioid use in Horry County. So we work with law enforcement to do medication take-back events. So if we can eliminate access to medications, whether that's from a 3-year-old or an 83-year-old, accidental use or even from theft, it's important for us to eliminate the unwanted, unused, and expired medications. With that same grant, we also offer medication disposal packets that people can utilize in the safety of their own homes so that they can dispose of medication without any fear of judgment from others. We give those away for free to people in Horry County. We also have safe storage boxes, so we call them lock boxes, and we give those out for free too, as long as supplies last under this grant that we have. And so that's also important because obviously there's still going to be medication in homes, and if we can secure that safely so that people don't have easy access to those, it's very important. We also do other things in the community too, such as merchant education. We train merchants, anyone who sells alcohol or tobacco products, we can teach them the laws and liabilities associated with selling to minors and also, safe serving for adults. And then we provide that to any outlet, whether it's a convenience store or a restaurant, a nightclub, anything like that. We can provide that. We provide it for free. Most of our prevention services are. And then we also, I could go on probably for an hour with prevention services, but we do educational things in the community. We offer multi-session evidence-based programming that we would like more youth to take advantage of. It's probably our most effective strategy in reducing substance use among youth. So the more youth we can get involved with that, the better. We do a lot of work with law enforcement to make sure that outlets that sell alcohol and tobacco are compliant with the laws associated with sales. And then we also have the Horry County Cask Coalition. It's a group of community members and organizations that work together to try to reduce substance use. So they've been doing like Project Prom activities. Even just this week, they've been in the schools getting prom promises from students and actually hearing stories of students that were really planning to be sober during the prom season. So it's a really, really good thing to hear.
So if somebody's interested in getting some supplies for safely securing medication,
Yes.
or we have a business owner who would like to get connected, how can they do that?
They can just contact me or even just call up to our front office if you don't remember my name. You can get with me afterwards, or you can call Shoreline and have access to any of those resources.
Great, thanks, Jesse. Any other panelists want to share with us the services that you offer for substance use and teens?
Okay, so I have to follow Jessie, so I don't have as much as she does, but I work out of the Live Well office at Coastal, and my primary role is to meet with students that get a violation for violating the student conduct policy. So if any student gets in trouble with either smoking marijuana or drinking alcohol on campus or close to campus, then they have to go through the Dean of Students for the conduct process. And then after that, the Dean of Students sends those students to me so I can meet with them for normally 2 sessions. So what we do for the first session is we do a brief alcohol or cannabis screening. And then after that, we do what I use is called eCheckup to Go. And it's an online program. And what it does is it assesses basically a deeper dive in the student's use. So whether they use alcohol or cannabis, they have to go through that program. And then I actually meet with them as well and go over their results. And I basically talk about moderation, harm reduction, safe, we call it safe partying, because we know that students are going to use, so we can't pretend we don't know. So the more we know what they're doing and when they're doing it, the better educated I become, then I can educate my students. And what also we do are outreach events. So we go out on Coastal's property and we educate students basically on everything actually. So cannabis, alcohol, we celebrate Alcohol Awareness Month, we celebrate Collegiate Recovery Day, we celebrate every possible awareness actions that come up. Sorry, I'm a little nervous. This is my first time. What else do we do? We do actually a lot. I knew I would blank out. What else do we do? We have peer educators. So we have students that work with us at the Live Well office, and they actually go out and they educate other students about alcohol use disorders, substance use disorders, mental health issues. We also have an interpersonal violence prevention specialist on campus, and so the peer educators work with her as well. So we like to get students involved because it's best that students learn from other students, not from us old people. So yeah, so it works really well. Wow, I can't even remember. I'm sorry, but we do have prevention, and we do have actually a collegiate recovery program for students that are in recovery. That was established 2 years ago, and it's called Chance for Recovery. Right now I'm working with 5 students that are actually in recovery. So we do check-ins with them. We also reestablished an AA meeting on campus because what happened is COVID hit and we could not really resume that. So we started that last week. So they run every Thursday evenings. So that's been a hit. So we're trying our best. We also have a no vaping, no tobacco use policy on campus and on campus property. And that's what I can remember. So anybody else?
Thank you. Bruce again with the Center for Counseling and Wellness. We are primarily set up to deal with mental health and substance use disorders from an outpatient basis. Now, that being said, we go into a lot of different facilities around the county. We are in CLA, Coastal Leadership Academy. We have 2 counselors down there. If we want to think about it in a different way, treating the mental health side of it, of course, we have licensed addiction counselors who are trained to work with addictions. If we can assist improve the mood of said individuals, since we are talking about mood altering substances, you can decrease the risk. And that's one way to decrease the risk. So we work a good bit on coping strategies, healthy mental health strategies. We have a lot of different referral sources, one being DSS. So part of the screening process, part of the intake and the evaluation process, if there's a family history, we know if there's a family history of addiction, alcoholism, and or mental health issues, the probability that the child or the offspring will have potential to develop them. So intervening, like in, I know as I speak, we'll talk about intervening as part of treatment. You know, we're talking about illnesses and issues and that are progressive in nature. So if you can start to get to the root of the problem early, early intervention will help decrease the severity of the problem. We do know that the sooner a person starts using any mood altering substances, the more likely the severity of that use will continue. So the longer we can prolong that age of first use, just out there for parents in general, the better. That doesn't mean you can't develop problems later, but it does decrease statistically the severity of those said problems. But we have about 4 offices. Well, we have 4 offices throughout Horry County. We're in a number of different sites. We try to intervene at the spot we are called to. And that's we don't have Shoreline has a wrap on prevention. They do an excellent job. Shoreline Behavioral Health Services. So I'll give them a little plug. We don't have the resources to do everything they do, but they do a fantastic job for our county.
Thank you.
So at Waccamaw Mental Health Center, depending on the child's age, that would depend what the evidence-based intervention would be. Being able to work with the families, at Waccamaw, they would, I'm saying they because I'm at the police department, so I feel a little bit separated, but I have done that, worked in the high school before. So working with the families, trying to educate the families what the warning signs are for those individuals. And then during those therapeutic interactions, we typically try to work with individuals where they are at. So trying to utilize those, no judgment factors and keeping that line of communication open so the individual will continue to talk about what their motivations are, what their pressures are, those sort of things. So like already touched on earlier, practicing those coping skills, figuring out, how to remove those stressors from their life. And then educating the family if I didn't say that. So, yeah.
Great, thanks, Ashley. Anyone else?
So I handle it a little bit more from the enforcement side. There is always a citation usually issued with this kind of stuff for us. But on the back side of it, we normally try and get kids signed up through the court so we can court mandate a tobacco prevention program through the Department of Health. And completion of that program only takes care of the tickets, so they're usually highly incentivized to complete the program. As far as prevention goes, we just recently started running DARE programs at the high school. We're getting ready to start our second DARE class here shortly and are in the process of coordinating with some other local groups to have some DARE programs over the summer. So we're looking forward to all that stuff.
Great, thank you. Anyone else? All right, we will move on to our next question, which is anxiety, depression, and other mental health concerns have been rising among youth and citizens in Horry County. What prevention services does your organization offer to assist with mental health?
So one of the wonderful things about being embedded in the police department is that in order to work with the individual, they do not have to become a client at Waccamaw Mental Health Center. They don't have to get a diagnosis, and the services are free. So being able to work with them in that capacity really helps.
It's me again. So we do have counseling services on campus, and what they provide, they do individual counseling, couples counseling, groups. They also do workshops for all the students, and they also do outreach events. They do crisis intervention. We also sometimes send students to the local hospitals to get stabilized and treatment. And they also collaborate with Live Well. So there are a lot of times where we both go out onto the lawn and we try to educate students and, definitely reduce the stigma of mental health, because we are working with college students. So sometimes they're just really embarrassed to say that they need help. So then what we try to do is we try to make sure that they understand what's going on and how we can help.
Hi, I'm Kathy. Mostly the work that we do in intensive outpatient is not necessarily as preventative as some of these programs are talking about. We're trying to prevent it from getting worse. And getting people into services, getting people the counseling they need, addressing the issues they have. We have an intensive outpatient mental health program. We have an intensive outpatient addiction program. One of the things that, because I work with adults primarily, is that I get a lot of questions from the adults when they're stable and doing well. How do I tell my children what's going on? And first of all, I always tell them your children already know. One, but second, let's talk to them. Let's talk to them if it's age appropriate and make sure that they're, again, old enough to understand. But we know, and up here in the panel, and many of you out there, that children of addicts, children of alcoholics, children with people with mental illness stand a higher risk of obviously developing these issues themselves as they grow. We want to educate them, make sure they understand what services, what to look for, that they can go to people for help. We've talked about the stigma. That's absolutely imperative that we remove this right from the get-go. I mean, from this community, we have a lot of issues and we have a lot of people that need help. And we just need to let them know it's okay to ask for help. I think I spend 4 days a week for at least 3-4 hours a day talking about how it's okay to ask for help. And that's, and anything more prevention I get out there is the word that please let people ask and bring them into services. And, let's start a dialogue about what's really going on. Because there's a lot of people with a lot of anxiety in our society today. And I think we can help a great deal. We got a lot of work to do.
So I'm Michelle Smith. I'm the opioid program coordinator for the city of Myrtle Beach. Obviously, I'm the opioid program coordinator, so the basis of our program is obviously centered on substance use disorder. However, there's a lot of intersecting factors that come along with that. While we're mostly a reactive program and a response program to different crisis events, especially overdoses and things like that, our main goal is to try to prevent a future crisis event. So one of the main things that our team is going to be focused on is not only that individual that's suffering from substance use disorder, but any family members or children that might have experienced any secondary trauma as a result of the nature of addiction and things like that, and being able to connect them with services just to provide them the tools that they need to work through that and healthy coping mechanisms.
Bruce again. So anxiety and depression are the number 1 and 2 mood disorders that a physician will see. One of the ways, obviously, we do get physician referrals, and the integrative healthcare model, trying to identify it first. You can't think that's identifying the problem can help us lead to the solution. As far as anxiety and depression, what are the appropriate things? We saw with teens an uptick. I remember when the lockdown first happened with COVID, everybody was kind of rallying around. Teens actually enjoyed it because they got to stay home from school. But as they were taken out of their daily environments and staying up for much of the evening, and now we're getting into social media, electronic stimulation, something there. It's somewhat normalized back to, typical rates, I guess, a little bit, but teens growing up today, I graduated from Myrtle Beach in 1996, so I'm proud to be and proud to be on this initiative and collaborative. This is my hometown. Mostly I was born in Virginia, but lived in Myrtle Beach most of my life. It's a much different society. I have 12-year-olds, and the world they're growing up in is much different than most of the world that we grew up in, and always being connected and having constant influence. When I got home from school, I was safe. No matter what happened that day, somebody called a landline, but that was it. So I think that's where parents of different generations, have to recognize this is a much different world and all those influences. I mean, there's a great documentary, I think it's Social Dilemma, that gets into exactly how social media works. There's an addictive component to it that, you can, I'm not sure how many of you've seen the Social Dilemma, looked at some of those things, but you can get 100 likes in the first minute after you post something, but it drips it out to you, and they know how to rally you in to be able to addict you to that platform. So the sources of anxiety, getting to the nature of that, whether it's counseling, whether it's medication, wellness-oriented activities, and that's another big focus. There's something called Rat Park. I'm not sure how many of you in the room are familiar, but they put it's a 1970s, 1960s experiment, but they put rats in what they called Rat Park. They had a laboratory with rats with no stimulation in it, and they had a morphine drip in one water bottle and a regular water bottle. In the one with no stimulation, the rats tended to go to the one with the morphine, of course. Then they had another one they called Rat Park with all types of, it was like a rat amusement park, had all types of simulation. In that one, they found that the rats just drink the regular water, not the one with morphine more so. So that's been an old experiment. There's different discussions around it, but making sure our adolescents, our teens have healthy activities to enjoy, whether it's sports, whether it's leisure, whether it's faith-based, it's vital.
Hey everyone, this is Scott from Grand Strand Behavioral Health. I think there's 2 things that pop in my head. The one is the stigma. That was, you hit the nail on the head with that. Just to think about it this way, I always tell clients and other people out in the community, if I had cancer, would you have more empathy or less empathy if I told you I had a diagnosis of major depressive disorder? So we have to think about that. If I had a broken leg, I think you'd be more empathetic than saying I have anxiety. not maybe all you, but I think out there in the world. And then the second thing is the CDC reports that adolescents, especially females, we're in a crisis right now, mental health. And there needs to be big action. And I think talking about it in an open forum definitely is a start, not the finish, but is a start. So thank you.
So I have a question. Oh, Tanya, go ahead.
So one of the things when we talk about stigma in healthcare is we really try to normalize and just talk about how stress affects us at all ages, and that not everybody who might experience some anxiety or depression has that DSM-5 diagnosis. And so really just normalizing and just asking those questions. At Little River, what we've done over the past 2 years is we began teaching mental health first aid to all of our employees, because we want to make sure every one of our employees, from housekeeping to our patient check-in, know how to assist and identify what we call a mental health crisis or a mental health challenge. Not that they have to step in as a behavioral health provider. And so we've begun providing that mental health first aid education in the community, because we're hoping that's going to help.
So can you help us understand? So I know I hear a lot of folks all the time saying, I have anxiety. I have anxiety. And that word is used a lot. Is it helpful to name and say, I'm anxious, I have anxiety? Or is that a term that you think would be helpful to be reserved for a clinical diagnosis? I'm trying not to ask a leading question, but I think I am.
I think when it starts to impede daily life functioning is when it becomes a clinical diagnosis. It's a tough question, to be honest with you. I think it's okay to have anxiety, but not everyone has an anxiety disorder, if that makes sense.
Do you think how we use the language that can be a clinical diagnosis and a behavior or a characteristics is confusing to people?
I think it's often misused.
Got it.
Misused. For example, there's people who maybe have gone through a traumatic situation and say, well, I have PTSD. Well, as therapists, we all know that you probably don't have PTSD. You might have acute stress disorder, or you've been through a traumatic situation. It doesn't mean that we're lessening that trauma, but I think there's that misinformation out there. I don't know what everyone else thinks.
There's no right or wrong here, but I think when it comes to stigma, we need to talk about language.
Absolutely. I spend a lot of time with my adult patients in substance abuse talking about feelings and emotions and learning to normalize that conversation, because a lot of them don't understand that anxiety is okay. Anxiety is a protector. We are born hardwired for anxiety and for anger, and it's our fight or flight, and it's okay to have it. It's when it's going off. I talk about it as an internal alarm system a lot of times for people, so they can realize what that is. And if it's going off and you don't know why, then maybe we really need to look at it. You know, if it's going off because you're walking down a dark road with cash on you and you're hearing noises, well, that's protecting you, and that's what it's there to do. So the same thing with depression. Depression is something that there's a clinical diagnosis for, and then there is a depression that we all go through from time to time. Okay, it's very appropriate. Okay, guilt and shame or boundary emotions. These are appropriate emotions. I tell my patients that all the time. It's very important that you have these boundaries. That means you have a conscience. Thank God. Otherwise, I got to see it. No, just kidding. But again, I do think that's the conversation we do have to have. And again, I don't treat a lot of adolescents, but I'm more than sure that they don't understand that, and the adults don't. So we need to educate all of them. When families come and talk about, it's okay to have these feelings. It's okay to talk about them. Let's get them out. Let's see what we're dealing with. So absolutely.
I think one of the things that I've learned, throughout the years is, especially when it comes to stigma, there's a lot of labeling that goes with stigma. And so when you think about youth and adolescence, stigma and labels, so I'm kind of on the flip side, like my girlfriend sometimes will be like, I'm depressed. I'm like, oh, are you? You are. Let's go down the list. Or are you just sad? right? So with adolescents and youth, once that label, they interpret the label of like, I have depression, I have anxiety, then there are certain behaviors and patterns that come along with that. And so it's almost like they put themselves in a box because of the label, as opposed to what their own symptoms are. So I just felt like that was an important, piece of that, because that's how it does influence our youth in a more negative way.
Thanks, Ashley. Anybody else want to weigh in on that? So language does matter. So being able to refer to folks with their experience, like you've heard me say, a person experiencing homelessness, a person with post-traumatic stress disorder, a person dealing with depression versus a depressed person. So that is one way we can start helping with moving away from that stigma and not defining somebody by their experience, by saying that's who they are, but making it about the experience. All right, I'm ready for the next question, and this is going to be a tougher one. So we can hear in Horry County and beyond that it can be hard to access services. So if a teen needs to access services for substance use and mental health, how can they actually make it there, and what does that process look like? So if there's an adult in the room that wants to take a teenager, whether it be a family member or a neighbor or someone they know, what does that process look like? Because I want to break down any myths or misconceptions we may have. Can you walk into an office and get treated that day? Do you have to go to the office several times through a process? So you see where I'm going with that? What does it look like to actually get treatment? Here, we'll just start using this one.
Oh, I'm sorry. All right. Take the MC's mic now. What do you think? For the center, same day possible, depending on what the schedules and the location given. We have 4 different offices. You can make a phone call. Typically, we prefer a phone call. You can walk in and come in, fill out some paperwork. We have about 30 different therapists out of the 4 offices, so we actually do try to identify clients' needs with the appropriate therapist who specializes or has the appropriate credentials and said issue. Possibly with in the next day, if you make a phone call, you can possibly have the appointment the next day. It's going to be different for every agency up here. She and I were at a meeting yesterday that was kind of part of the discussion with United Way. So, but yes, you can call the center. We can possibly get you scheduled the same day, next day, within the week for a teen, adolescent, or adult, either substance use or the mental health. So it's not an elaborate process. We need some basic information, and we go from there. Give hers back.
Okay, so we do offer same day. You can be seen whenever you come into Shoreline. We call it open access hours. So a parent or someone can bring the child to Shoreline, and they can be seen that day during our open access times, specifically on Monday, Tuesday, Wednesday, and Friday. We do not have that on Thursdays. I'm sorry.
We've been having trouble trying to not only contact you, but have someone answer the phone.
At Shoreline?
At anywhere. I mean, I've had 2 situations where they were homeless or they were abused. We couldn't get a phone to answer, someone to answer the phone.
At Shoreline, we have staff dedicated to answering the phones. I apologize if that has happened to you at our agency. And if you want to talk to me afterwards, we can make sure we get you some help. That unfortunately that can happen at anybody's agency, I think, just with the demand that we have specifically for the amount of clients that we see. Sometimes it is hard to be perfect, I guess. So I do apologize, and we can try to make it right for sure.
Thanks, Jesse. And does your agency have on their website or everyone like a spot, like if you can't, the phone lines are busy, do they have like a spot you can click on and email if you have a question a grievance, an issue, or a compliment?
Yep, we have basically like a contact us area where people can reach out to us and contact us. And it has our phone numbers, it has our open access times where you can be seen that day. It is a lengthy process at Shoreline, so be prepared to spend a couple of hours there for the very first meeting. So didn't want to make that known too, but you can be seen.
I have a question.
Sir.
Is there any kind of an umbrella number that if I didn't know your number or your number or your number, but I was on the street, that everybody would have an umbrella number that they could go to where you would all be under that umbrella and it could come down?
I believe 211.
211. That's what I thought.
We got a representative, I believe, from 2.
Who's here from 211?
Somebody here from 211.
I saw her earlier. Okay.
So 211 is a resource number. So you can dial it and let them know what questions or needs you have, and they will navigate through what local resources are available. They will then give you that contact information. For suicide, there is a number that is 988. So 988 is the number for suicide. Are there any other?
There's also South Carolina Hopes, which number is escaping me right now, but South Carolina Hopes is for mental health substance use.
Is there an educational program that gives those numbers out to all the kids that have an appropriate age?
So the question was, is there a way to give out those numbers to educate anybody, to give
Everybody.
to everybody for that information? Well, I tell you what, let me roll it in. You just paved the way for our next question. Let's talk about what media campaigns does your organization implement, or any marketing that you're able to do to get your information out to the public. Is that we'll get started there.
Well, I will say, because I don't know if anybody's here from Horry County Schools. I don't believe so, but I know, right? So their ID. So do you want to share about that? Because I'm a parent of Horry County school children, and I love what you guys have done.
Do you want to come to the front, or do you want me to meet you halfway? Right at the borderline?
I like you. Just come on up here.
Hey, I'm Tanya Pickett. I'm the Director of Counseling Services for Horry County Schools. And this year, we put the 988 number on the back of all of our ID cards from Atlanta High School students.
Yes.
So those students have access to that information. If there is a mental health emergency or a substance abuse emergency, then they have access to be able to contact. And I think as a parent, I am also a parent. And when we made that change, parents got notified that it was on the back of their ID so that they would know that students had access to that. We also, every student, if you're a parent of Horry County Schools, you know that your students, from the time they're like in the 3rd grade, they get an email address. And so in addition to sending that information to parents and giving them a new ID, all students got an email with their downloaded ID. So, and it showed them what it was going to look like when they actually got the hard copy with that number on the back. So.
Thank you.
Thank you.
Thank you.
We're going to have a Q&A at the end, was one of the questions, so we'll reserve a little bit of time for that as well.
Can I jump back real quick just to admissions? So I work in the outpatient, but we have an inpatient called the Lighthouse, and it does treat adolescents. And so the process for that, we have a 24/7 line and admission office, and so they're open all night long, all day long. And I know it can be difficult and challenging. It does take a little time, but if you have an adolescent who is in need of services for mental health or any issues, to call that line, they will bring you in and they will do the process, and they can do same day.
What if a youth does not want to go to a mental health or substance use facility? What other resources are available in the community that they could access?
I always say start with the pediatrician, their family medical provider, because that's the first place that an individual can start. At Little River Medical Center, you have to be a patient, but we do have same-day appointments. But I always say, start with if you have a medical provider, start with the medical provider.
Are there any youth peer support programs or services? And can you say that into the mic?
I was going to say that I don't know.
Louder.
I don't know.
Okay.
I know that Waccamaw does have same-day appointments. They have walk-in appointments. I know that they have extended their hours. I'm not sure what days those hours are extended. On Wednesday until what time?
6 o'clock.
6 o'clock.
And we also have mobile crisis.
And mobile response.
Yes.
It's 24/7.
Do we have peer support specialists?
And peer
From
support
18 and up.
specialist, 18 and up.
Got it.
And
Yes.
So the question I asked as I'm walking to get some information was, are there any youth peer support specialists? So if someone does not feel comfortable going to a clinician into a facility, what's the best? Is that me? Joey? Do you have electricity? Is that probably?
The question is for the services that everybody's offering, and I might not be the only one who wants to know, which agency provides those to the uninsured, the underinsured, or has no funding to pay for it? Indigent people.
Little River Medical Center, we do, for medical, dental, behavioral health.
At Shoreline, most of our prevention services are free, and the majority of our clients are indigent, and we have resources to cover their treatment and their counseling and medication-assisted treatment needs.
So at Coastal, I mean, everything's wrapped in the tuition. So when they go to counseling services, obviously it's free for them. But we also started it's called Timely Care MD app. So along with student government during COVID, we weren't on campus, but students still wanted to get treatment. So what we did is we worked with Timely Care MD, and what the students can do is get onto that app through their Coastal email. And so at any time, 24/7, that student can receive counseling services by a licensed professional counselor. They can get substance use counseling as well. They can get medical care, and they can get psychiatric care. And Timely Care MD just started what's called Journeys. And what that is, it's little videos about self-care, and the students can use those. And we also have on-demand care also through the app. And what that does is it has on-demand yoga, everything to keep that student, engaged with Coastal. And so, yeah, and that's wrapped up in their tuition as well. So, I mean, you can't beat that because our counseling services are only available Monday through Friday, and same with our student health services. So they utilize that a lot. It's a good service.
At the center, we provide services from the United Way. We got a Breaking Barriers grant, so we are actually going into facilities, but you can call the Center for Counseling and Wellness. We can get you services regardless of inability to pay. We go into the homeless shelters, New Direction, North Strand Housing Shelter, Friendship Medical Clinic, which provides free medical services. We have counselors out there. So yes, we do provide services for those who have the inability to pay, and we are now putting counselors out to try to meet them in the community at various sites.
So we are technically not operational yet, but with the opioid epidemic, things like that, we're hoping to be out in the community within the next 2 weeks or so. We just got approved for funding, and with that approval, there is a limited amount of funds that will be utilized for any individual who is interested in any type of recovery-based services. Doesn't qualify for any other type of governmental assistance or any other grants and services that are provided. And that way we can get them to where they need to be self-sufficient. With that being said, we've also met with over 30 to 40 service providers over the past few months so that we are aware of the community services that are already offered. So we're not duplicating services or duplicating funding. And so that we know what services are available based on whatever that individual needs, since they're an individual. So they're going to, drive the bus, I guess you could say. They're choosing their own path to recovery. We're just there to kind of help them along the way to take that. One thing that we have discovered is that typically someone doesn't plan to come into a crisis event. So the knowledge about what services are available or what to do when you come into that crisis event, whether it be food insecurity, housing insecurity, substance use disorder, anything along those lines, Google isn't typically your best option. So the opioid response program kind of prided ourselves on knowledge about what is available in the community, but also what might not be available within the community and where to find that resource.
Just to touch on your question a little bit earlier, like, is there a unified platform, like a one place, one stop shop? There's some things in place that we're moving toward that. We were at a United Way meeting, several others in the room yesterday, the Unite Us program. There's some things going on in the background right now to try to get to a place where there'll be more of a one-stop shop beyond just 211. 211 is a great resource. Please utilize it, give it out to folks. It's a great starting place, but that's being worked on. That again, it can be frustrating, as I've heard, for assisting at the office earlier. Somebody was calling from Lexington, trying to find somebody, and they had actually a team. It can be frustrating. I get that from a provider standpoint, to try to, there's so many places to choose from. So hopefully some of that, and that's what these collaboratives are going, there's other collaboratives going to try to assist the community and try to assist the individual that needs help, because there's a lot of distress in that moment. I need help now. How do I get help now? And I think that's still something we're working on, and all the centers up here. A lot of time that you can go through 10 wrong or 20 wrong turns before you find, oh, wow, the lighthouse has been here all along. And that's part of what this community awareness and this community education is, so we know where to turn when we need to. Hopefully we won't need those and we'll be less, but I get that frustration too. And sometimes even from a provider standpoint, trying to find the appropriate place, or a place that has a bed open. And that's a whole nother issue. If you want to get on community mental health, and when they switched over back in the 60s to a more community model than inpatient model, that's a whole nother discussion for another day.
Y'all, I'm usually an optimist. Most of you who know me know that, but to provide a dose of reality. Tonight is one of those reasons so we can educate ourselves to learn about resources before the crisis occurs. The reality is there are always going to be services that we don't know about. And it's about educating ourselves. For decades that I've been in this work, it has always been, we need to create a new resource manual. We need a new resource manual. Those are always in the works, when really it's about being able to learn and identify what resources are here. And if you can't learn them all, what I have found is I have a couple of folks that I know I can pick up the phone and call. And if they don't know, they're going to connect me with an organization or the information that I need. So I want to be upfront about that. I think it's really about tonight. So I'm so thankful you're asking the questions, wanting to learn and to know, where do we get this information from? So yes, sir, Peter.
Oh, sorry to interrupt. As part of that, what would be helpful would be when a member of the panel gets asked starts to respond to questions, if you wouldn't mind repeating what your center is or what your program is, so that we'll begin to identify you with it as time goes by.
Thank you.
Excuse me.
Yes, ma'am.
I wanted to let you know, I'm with NAMI, okay?
Can y'all hear her? Or does she need the
Yep.
mic?
We can hear.
I can talk pretty loud. I'm with NAMI. We're actually in the process of working on a resource group that it's going to be on our website hopefully before the end of next month. And what it's going to show is where you can go for food pantries, where you can go for mental illness, where you can go for all types of, and pretty much any type of help that you need. So you'll be able to go to nami.org, and there's going to be a place right there on that page that will have our resource. Hopefully by, like I said, the end of next month, it should be complete. We're in the process of working on it now. And it's for all of Horry County. So you're talking the Georgetown, Little River, you're talking Myrtle Beach, you're talking all around us. because, the problem here is nobody knows where the resources are. And also that there's not enough for where we are, you know, so a lot of times you have to go out of the area actually to get the help you need. So we're just trying to make sure that people know where to go now.
Great,
Because I was
thank you.
in the lady that was over there situation not long ago, and I'm not gonna let that happen to other people if I can stop that.
Great, thank you.
Thank you.
All right, we are going to shift to one of our other questions. So Carol, get ready. Addressing homelessness is vital to the health of Horry County. What prevention services does your organization offer to assist with homelessness in our county? Pass the mic to Carol.
Yeah, I'm loud, but probably not that loud. I'm Carol McCall with the Housing Authority of Myrtle Beach. The Housing Authority of Myrtle Beach primarily deals with permanent assistance. That means our participants pay their rent based on their income. So in the summer, when they're working 80 hours a week, they're paying most of their rent. In the winter, when they're laid off, we're paying most of their rent. What we're doing is preventing homelessness. The major program we have is called the Housing Choice Voucher Program. And it's called the Housing Choice Voucher Program because they pick where they want to live. Now, our biggest issue is finding landlords. We've got funds, we've got people out there looking. It's finding a place that's willing to accept that voucher. And that goes with that stigma. The stigma of, I have assistance. I have a Section 8 voucher. You know, they've all heard the old Army movies with Section 8, and there must be something wrong with them to have a voucher. It's stigma. Besides the Housing Choice Voucher, we've got mainstream vouchers. Mainstream is for non-elderly. That means that somebody in the households between 18 and 61 has a disability. It does not have to be a Social Security qualified disability. It simply needs to be a disability that would be helped, a barrier to their living that would be helped by having permanent housing. That is homeless or in danger of being homeless. And a big part of our program is the in danger, because a lot of the programs out there, you have to be on the street before you qualify. This one is one that you don't have to be on the street yet. You just have to be in a position where you're gonna be on the street unless you get some help. Preventative. We've got the Veterans Administration Supportive Housing Program. That one's through the VA, and it's for homeless veterans. They have to apply through the VA refers them, and the VA case manages them through the process. We project-based vouchers because it's hard to find units. So we've project-based, we've agreed with some landlords to put some of our vouchers on their building so that when somebody moves out, the next person that moves in has rental assistance. But the person who moves out didn't just lose assistance by moving out. They get the next available voucher. So a person can come in, they can go into Alliance Inn, which is housing for the homeless. They can go into Swansgate, which is senior housing. They can go into Carver Grove, which is for veterans. And when they're ready to move out, they still have a voucher. They still have rental assistance. The person pays their rent based on their income. The landlord still gets their money at the first of the month. We direct deposit it. So if we can get landlords to realize that they're just people, they are no different than any other person on this planet. You can have someone that can afford to pay $3,000 a month rent out of their pocket, and they'll still be the worst tenant you've ever had. And you can have someone that can afford out of their income to pay $8 a month, and they'll be the best person you've ever seen. So reducing that stigma of, I need help, that's a big part of being able to house people.
Carol, how does someone apply for assistance or help through the Myrtle Beach Housing Authority? What does that look like?
When our Housing Choice Voucher waiting list is open, we do it online and as a lottery. Now we'll contact all of the agencies out there and ask you to help your participants apply. Because it is online, and a lot of people don't know how to use a computer. It is the barest minimum information we can collect and get them on a waiting list. We want your name, date of birth, social security number, and about 5 questions. Most of those are how to contact you. The last time we opened it at 8 o'clock in the morning on a Monday, closed it at 5 o'clock the next Tuesday, and took over 4,000 applications. That's how many people need housing. We did a lottery and took 1,000 of those and put them on the waiting list. And as people come off our program, we draw more names. That way everybody has a chance. Now, we do give a double chance to people with disabilities. A person with disabilities gets, if we're calling in 100 people, 50 of them are going to have disabilities, going to go through that list. Then we're going to put everybody back in the pot and draw them again. So that the person with disability did have 2 chances to get drawn. But they come on in, we go through their paperwork, however much help they need to go through it. We brief them, we explain the program. This is permanent housing. They can have that voucher for as long as they need it, as long as they follow the program guidelines. And we believe in second and third chances. For someone with the mainstream, now right now that Housing Choice Voucher list is closed. We've got 700 people left on that list. But if you if you're qualified for a mainstream, you're non-elderly, disabled, and non-elderly includes somebody who's 18. This isn't 25. This is an 18-year-old that's disabled, that needs housing. You can come in and apply for that anytime. That list is open. The Veterans Affairs list is open. You go through the VA. The properties that we've got project-based, come on into the Housing Authority. Those waiting lists are open.
Thank you, Carol. Any other organizations have addressing homelessness through any of your prevention services?
Well, surprisingly and unfortunately, students do experience homelessness. So what we do is we have an advocacy and intervention part of the Dean of Students Office. And what we do is we partner with off-campus housing to place those students. And then we also partner for temporary housing, some hotels in the area as well. And then we also have a benevolence fund for students. So if they have any difficulties with rent or things like that, they can apply for the benevolence fund and we can help them with their monies. And also too, they experience food insecurity. So we do have a food pantry on campus, as well as opportunities to get some clothing for students.
So Waccamaw Mental Health Center does have care coordination. You do have to be a patient in order to participate in care coordination. Part of care coordination is trying to help people find housing. They do have grants where they do help pay rent. In other counties, they actually have housing through Waccamaw and different partnerships. One of the ways that I think that is most effective at preventing homelessness is those individuals with severe and persistent mental illness. We have intensive services for those individuals. So those individuals are sometimes seen 2 to 3 times a week, sometimes daily, depending. And that is one of the best ways to prevent the individual becoming homeless. Just keeping them connected and those daily living activities and all of that. I am trying to think of anything else in regard to that, and nothing's coming to mind.
So at Little River Medical Center, we do have funding to assist individuals towards housing to prevent them from experiencing homelessness for our patients who have HIV. But I think we shared about stigma. I could have money. I do not have landlords who are willing to work with us due to stigma. Just last week, I dealt with a landlord who would not accept a third-party check would not accept a check from our organization, said I have to give it to the individual to pay in cash. And federal law prevents me from doing that. So I wasn't able to help that individual. So in our community, it's finding more landlords for sure.
From law enforcement side, I can say most of our officers keep a pretty knowledgeable list of where people can go to get help if they're experiencing homelessness, or whether it be local food pantries, stuff like that. We also have our community service officers like Officer Eller, who's here. He's constantly reaching out and locating people who are experiencing homelessness and making sure they have the information they need to keep moving forward. We also identify some kids in the schools that are at risk, and we try to provide them with some meals throughout the year through programs like Greg's Groceries and reaching out to them, making sure that they get what they need.
Scott from Grand Strand Behavioral Health. Our discharge coordinator on the inpatient side, they have a program in the state of South Carolina called Well Vista. I don't know if anyone has heard of Well Vista. And that's a very, very beneficial program for people who don't have insurance or don't have the money for their medicines. But Sasi was saying, kind of a vicious cycle, mental health, and then you have the homelessness, then you have the drugs and alcohol, and it all kind of spirals out of control. So Well Vista provides medicine at a reduced or even free cost for individuals, and we try to coordinate that with people before they're discharged from our inpatient facility.
Bruce Lentz with the Center for Counseling and Wellness. As I previously mentioned, we do send therapists into several of our homeless shelters, North Strand Housing Shelter, New Directions, but I was just going to also say we started the Myrtle Beach Police Department right along back in February, at the beginning of February. One of my therapists that participates is back there, a social worker for the social workers in the room, Patsy Alexander, and she's been doing a great job. But I know the first night I rode along, that was some of the issues I was involved with or intervened with some of the Myrtle Beach police officers, is some of the homeless individuals. This was the coldest night we had, I think, so far this year. And that was one of the issues. The person was kind of refusing to get discharged from the hospital. It was cold. Didn't want to be discharged from the homeless shelter at the set time. I mean, this is where the problems start. Like, for that individual, there wasn't, they had a walker. It was a very cold night. They had a lot of trouble with mobility issues. These are like some of the issues where there are gaps, and this is where all of these collaboratives are kind of coming up with what to do for the folks that are falling through the gaps. We know there's gaps, there's gaps, and that's part of what these initiatives are. How can we shore up those gaps?
Michelle Smith, opioid response program with the city of Myrtle Beach. Unfortunately, a lot of my answers are going to be the same tonight, just for the simple fact that we try to treat that individual as an individual. So we kind of assess where they're at. They might benefit from one agency much more than another. And I feel like our team members can identify that, but I also have those relationships where they know who to call given what situation. But right now, our biggest problem is finding those individuals. So we're going to be starting out with a lot of outreach. A lot of it is going to be a response program. But I'm kind of hoping through all of the things that are already in the work with a lot of our service providers up here, the coordinated effort, getting our name out, getting that reputation within the community as a centralized location that people can call and feel comfortable calling, that we'll be more proactive in the coming years. I would love months, but being realistic in the coming year or two.
You're going to answer. I was about to. You can go ahead, Joey.
How about the rate?
Yes, I was waiting. Joey, mark it down. That's my boss. I was listening before I chimed in. So I work with ECHO, and in Horry County and our PD community, 13 counties, we have what's called a homeless crisis response system. And what that means is if someone's experiencing or at risk of homelessness, they can go to echousing.org, get help at the top, or they can go to, and we'll send this out, our HUD Continuum of Care website, get help and answer some questions. Our housing providers for folks at risk and immediate risk and experiencing homelessness are ECHO. We have a homeless prevention program for folks who have a court-ordered eviction in their hand. We also have a Sea Haven has a rapid rehousing program for young adults as well. So please remember, coordinated entry is that entry point for services. Joey, you want to add to that?
Yeah, just a couple. I'm glad you said Sea Haven, because it's focused on you. But the homeless prevention program, and it does, I mean, a eviction notice is great. It's if they're in jeopardy of losing their primary nighttime residence within 21 days. So that is true prevention to keep them from becoming on the street. We were administering the ERAP program, Emergency Rental Assistance Program for the county, and to let you folks know, and that was only in Horry County. Over $30 million has been spent in 18 months preventing evictions and paying back rent in Horry County through that program. It's over 5,000 people served. It's like 3,000 households. Staggering numbers, but the HUD ESG grants, the Emergency Solutions Grant, there are some other ones that we have that can do the prevention piece. And then to put it out there, Sea Haven focuses on youth. Now HUD defines youth 18 to 24. So if they're up to 24 years old and not accompanied by a parent or an older family member, they're considered, they qualify for that grant. The ECHO grants serve any population, so it could be youth or anybody. There's a 40-bed domestic violence and human trafficking, whatever you want to call it, serious problem here in Horry County. Like Ann said, we serve 13 counties. 88-90% of our services and housing happens in Horry County because this county has about unofficially a third of the whole state's homeless population. So there are 4 houses in Horry County, say crisis houses for domestic violence. It is not true that there's not a place in Horry County. 2 of them have been here for 5 years. The other 2 we just got secured, and they are starting to put families and individuals in there next week. So there are 4 houses here, then we also have 2 in Kershaw County if someone needs to be out of this area. So for the victim advocates and whoever with law enforcement or whatever, those houses have been here for a while. And what happens is we try to keep them in there 90 days or somewhere around that point, let them work with the case manager. And then we have the funding from HUD to put them in their own house on a 1-year lease. Over 300 women and families have been through that program in the last 4.5 years that are now in their own housing. There's also 4 houses for substance use disorder crisis. They're in a crisis. We do not operate halfway houses or sober houses, but if they're in that crisis, using or not, those are available. Beds are in there, so it still goes through the same process that Ann was describing. And then there's some housing like that for veterans too. Along with like Carol, the housing authority, we've been working together since day one, but it's just to limit the number. And the problem is what everybody up there is saying is the landlords. And I just want to make a point. There is a gigantic difference in affordable housing and low income housing. They are not the same thing. Most people that are homeless, if that's 0 to 30% percentage of the area median income, most of them don't have income, so it's hard for them to pay a portion of it. So there's a crisis, like we're talking about the opioid crisis. There's a housing crisis because they're not there. And a lot of property owners and landlords are extremely angry due to the eviction moratorium that lasted almost 2 years. Now they don't want them. So, but just make sure that there's a big difference in affordable housing and low income. And we have a serious lack of both of them.
Thank you, Joey. And then the last thing I'll add to that, our PD community was recently awarded a Youth Homeless Demonstration Program grant. We call it YHDP. So that will be covering Horry along with all of our 13 counties. We were awarded $3.1 million, and that's over 3 years. We are currently in the process of doing a coordinated community plan. So if you would like to know more, please see me afterwards. We are currently trying to learn more about our youth experiencing homelessness. And I will tell you, out of our youth that have responded to an anonymous needs assessment, the one thing they keep saying we need resources and support with is mental health and transportation. So I'd love to be able to share more with you about that one-on-one. All right, I would like to now move towards question and answers to the audience. We're going to open it up. What I will ask, if you can ask one question, that way our panelists can field that. So we will open the floor and I'll be happy to come to you. Any questions? Did we cover all of it? All right, I'll come over here. Mary? Okay, we'll go to Mary.
Hi, Ann. One of the things that, the big gap is between, 4,000 people are on a waiting list and looking for landlords. And yet, when I look around here tonight, there are no business people and no real estate people. So I'm wondering, is anybody working on bringing in people who are landlords, bringing in people into the solution? It seems like there's a gigantic gap in the communication and then the understanding between the business people and the people who are serving the people who are in need.
Anybody in the audience or on the panel that can address that? Anybody from the business community, realtors, landlords?
I can tell you that the Housing Authority of Myrtle Beach meets with the Board of Realtors. We put on presentations to them. We've gone to this, the city or the Chamber of Commerce as business nights of business where they'll have meetings and we'll set up a table and we'll try and present. We do as much outreach as we can. Occasionally the lack of housing makes the news, and you've probably seen me occasionally on one or the other of the TV stations making a plea for landlords. We usually get one or two that way, but we do try to reach out as much as we can.
Any other efforts in the business community, realtors, that anyone may be aware of?
Or any suggestions?
Yes, suggestions are welcome. Mary, that is a wonderful question. We need help from the business community, the landlords. I know with ECHO, our agency, our housing case managers are always recruiting landlords, always trying to add more, but there's always a greater need. Yes, Jesse.
So I think even though I know you were getting in front of a group of like realtors, not all of them do rental properties. So identifying the ones that do rental properties, I think would be important. And that's just my suggestion, not knowing a lot from it, but also being a little bit a part of the real estate world might be helpful.
Anybody interested in being a part of helping to make that happen? Whether you want to stand up publicly now or you want to follow up with one of us afterwards, I think that's a wonderful point, Chief. Yes.
So I don't mind helping, and I also have my real estate license, so.
Wonderful. Hey.
No, I'll help. I don't want to help.
Oh, you're going to help. All right. We got Cindy down. Thank you. All right. We've got two that are going to help with that. Thank you. Kate, you're going to help, or you have a question?
No, I will help as well. I was thinking about, we've got a new business networking, we have a new business networking group that's, sorry, I'm really loud, that meets at the coffee house, and so I think it would be interesting to recruit them because being a little bit of a different space, and they decided that that's where they wanted to be. And so I think that I'll ask them if they'll help.
Great.
So, because they have bankers and property owners and agents, real estate rental, and yeah, agents.
Awesome. Thank you. Yes. I want to make sure everybody has a chance to hear.
I'm just going to add to that a little bit. I'm Roberta from the Center for Counseling and Wellness, do outpatient mental health. And United Way, I think, is not here, but I just wanted to give them a plug. Their Day of Caring usually involves a lot of businesses who contribute funds to United Way. And I participated that in last year, and they have that every year. So that brings a lot of business people who are recruiting their employees to give funds to nonprofits like us. And United Way has been our partner since we opened, and we wouldn't be where we are today without it. So I'll plug for United Way.
Thanks, Roberta. Anyone else? So we've already got, what, 3-4 people willing to join in and help?
Well, this is kind of aside from. So I have more of a, maybe it has to do more with behavioral and mental health. But I moved here from Tucson, Arizona 2 years ago, and what I've noticed in this area or part of the state is just a lot of racial discrimination, and it doesn't seem like people here like to talk about that or accept that they have that issue. But is that considered a mental health problem? Because I see a lot of people, just their behavior, it expresses that kind of ideology. And I see what's going on across the country with shootings and stuff like that. And instead of preventing that, I don't understand how people in a community like this could harbor that kind of ideology to express that that's okay to be against people of other races, especially when the majority of the people in this community are interracial. And a lot of places in the United States, people are not interracial. So I don't know if the mental health experts consider that part of the problem in this community or not.
Thank you.
Thank you. Follow up. We have a follow-up. Is that tagging on to the question?
I'm gonna make a statement, please.
All right, we'll let him make a statement while Sashi, I think you're getting queued up.
Okay, thank you very much. My name is Hector Ramos. I'm gonna read because I have a tendency to ramble sometimes. I want to thank the DICE for tonight's effort, the community, police department, and the few people that are here. This outreach is very important, but my wife is here, my granddaughter, 18-year-old granddaughter, is here. We've lived here 8 years. I'm a Vietnam combat veteran. I belong to VVA 925, which does a big part of giving back to the veteran community here. This is a great veteran community. My wife and granddaughter are here because our own 43-year-old daughter has again succumbed to drug use while trying to access unavailable services. New Directions is one of them. The elephant in this room tonight, there are at least 400 seats in here. And there's maybe 10% actual community people here besides the ones that I mentioned on the dais and, from the, all right, so the overriding threat in the country is fentanyl, laced heroin, and pills. The resources in Horry County can't currently meet the needs of everything covered tonight. Lastly, labeling. Someone here spoke about labeling a little earlier. There is no empathy for Black and brown citizens in this community. When you're outed as having an addict in your home, ignorant neighbors share the shame and affect the addict's child. That is a beautiful young lady right there that's been affected by our own neighbors because they're ignorant. Now, gated community dealers are poisoning kids in our community. This is the Bible Belt. Whatever happened to there, but for the grace of God, go I.
Thank you. Sashi?
Thank you so much for sharing that. I think that one of the challenges in addressing that, especially in an organization like Waccamaw, where there's policies, procedures, you are assigned patients, that sort of thing, to step outside of your role in that position is really hard. When I first started working, I'm sorry, my name is Sashi, I'm at Waccamaw Mental Health Center. When I first started working for Waccamaw Mental Health Center, I was fortunate enough to be a peer support specialist. So I worked with individuals from the perspective of having one or more diagnoses myself. And I got a lot of patients that were harder for the counselors to work with. The severely and persistently mentally ill individuals who, needy kind of thing. And they really weren't, I came in and I read my position and I read the rigs on my position, and then I fought and I fought and I fought to change the stigma associated with having mental illness. And I'm saying all of that to say each individual employee is just like going through the drive-through or going into a store. One employee can have one attitude and then the other one just be gentle and kind, respectful and loving. And so I think, and I'm very passionate about this, I think that it's a personal choice. And I think that the only way individuals can change their perspective is by having the conversations, those hard, ugly conversations, and exposing those things, talking about those things. That's why I appreciate both of you speaking up. You know, it was a passion of mine to try to get African-American males, Latinos, people with different ethnic backgrounds, not only to get the services that they need, but to try to encourage them to, because some of the obstacles associated with that is family values and ethics and how they are different in our cultures. And so sometimes those individuals don't have the family support that they need, or the obstacle is they don't want to say that this is what's going on because the hierarchy of the family believes differently, if that makes any sense. I know that Waccamaw Mental Health Center has a very diverse staff. I couldn't get the word out. Has a very diverse staff. We have a DEI committee that's focused on diversity, equality, equity, and what is the
Inclusion.
Thank you. So they are constantly having trainings for our staff. Those are free trainings for our staff. This month, one of the things that Waccamaw Mental Health Center is doing is staff are encouraged to share their stories about obstacles, successes, anything that they feel like, you know, they need to personally share with everybody else, so we can start having those conversations, not just in our community, but if we're not having those conversations with ourselves, then we're not going to be able to talk about those things in our community.
And then just the only thing that I'll piggyback on that, Tanya at Little River Medical Center, it's real important that we focus with, I know, our own staff as looking at our implicit bias and our microaggression. Because if we're not willing to do that work within our team members, we're not going to be able to serve all of our community.
Bruce Lynch with the Center for Counseling and Wellness. When I hear you speak and I hear some of your story, you know, I'm a person in long-term recovery. By the grace of God, I celebrated 20 years this past February, one day at a time. We'll keep it there. But I say that, I look all right up here with the jacket on, but I was homeless on the streets of Charleston for I took a leave of absence from college at the end of that first semester, or that first gig, and I was pretty much dropped out. I remember people looking at me. I had dreads, walking down the streets of Charleston. I did not look good, but I remember people looking at me. I couldn't identify the look. I was in a recovery meeting one day, and I heard this lady share that people used to look at her with a mixture of pity and disgust. And there it was. I remember that look. I remember that look, getting that look. Now I say that the Center for Counseling and Wellness, we have a faith-driven mission that is at the center of the whole Center for Counseling and Wellness. You know, I had an angel on earth. I went to a faith-based homeless recovery rehab. That's where my whole journey in sobriety and recovery started. But the lady who ran that program, it was Faith Home up in Greenwood, South Carolina. I think she actually just passed, if I'm not, just her. But she prayed a simple prayer with me. I'm a child of God. You're a child of God. I'm no better than you. I'm no worse than you. I try to start every conversation. I try to approach every person in that way. And at leading the center, if I hear anything other than that from my staff, I think that's a terminational offense. So I'm not sure how to address the other things from the community, but I hear you. We've got many issues from a community perspective that could be addressed. And I don't,
Not enough resources.
not enough.
Not enough resources in this state.
Our
Really
Go
quick, billions of dollars have been distributed with that lawsuit to the state of South Carolina.
Talk about the opioid lawsuit?
Exactly.
Okay.
Where that money should be coming to you folks to serve the community as needed. We don't hear about it on TV and we don't know anything about that money. Where's it going?
So I can actually answer that. So unfortunately, it's a slow process like many things. But the state, South Carolina Opioid Recovery Fund Board, I call it SCORF, because it's a lot easier to say. Over the next 16 years, so they have it starting at 2021, they just did their first disbursement of funds to the guaranteed political subdivisions is what it's called. So it's divided into two separate categories.
Guaranteed political?
Yep, so the opioid settlement is divided into two separate categories. The first one is the guaranteed political subdivision, and that includes all of the counties and municipalities in the state of South Carolina, each one given a set percentage based on overdose rates in that area. Horry County was allotted 5.2%. The city of Myrtle Beach was allotted 1.9% over the course of 18 years. So with it being 2023 and the delay, we have 16 years left. The other fund is called the discretionary subfund. For the first 9 years of that fund, 85% of that settlement money goes to the guaranteed political subdivision, so the counties and the municipalities throughout the state of South Carolina. 15% goes to the discretionary subfund. The discretionary subfund is basically open to any and everyone who would like to apply for it, nonprofits, businesses, whoever, but they have to follow strict abatement strategies to directly combat the opioid epidemic. After 9 years, those subfunds are divided 50-50, so as of 2030. And basically it's at the discretion of the pharmaceutical companies that are settling. It's slow, but it's happening. The city of Myrtle Beach, we just got awarded our funding March 15th.
Thank you for that. How many of us have heard about this?
Michelle, can you share the website so that they could, because it's
So if you Google SCORF, there's an entire website.
Can you spell the acronym out, please?
Absolutely. SCORF. I don't know the actual website, but if you Google that, it's the only thing that comes up. But full transparency, different tabs. They do, as of the first Friday in April, they do virtual coffee. So you can log in, ask any questions to the board, things like that. But yeah, we just got awarded the money. I plan to do a press release eventually, but there's a couple things that I need set in stone first. So it's a slow process. I understand your frustration, but we're trying.
If you've signed in, we will send that link out as well as a presentation that at DEODIS, who is our state alcohol and drug organization, they did a presentation when the funds were awarded, and they did a press release in June of last year. We'll send that link as well. If you've signed in, just make sure that you signed in before you leave. There's a clipboard going around. We'll shoot you the email link.
And I can stay after too if anyone has any questions about it or if you want to talk further.
I just want to mention, Scott from Grand Strand Behavioral Health, I just want to mention that how many of our jails are filled versus recovery and inpatient hospitalizations and programs, right? So I think it's on a community level, I think it's on a state level, I think it's on a national level. So I thank you both for holding us accountable up here too, because, you know, we have to hold ourselves accountable and take a look at ourselves also as part of the process. At the same time, how many people in the prison system have mental health difficulties or drug and alcohol difficulties, right? But I think as a society as a whole, I'm getting a little philosophical here, but I think as a society as a whole, we'd rather put people away and not think about it than try to treat these individuals, right? So I think it comes from, like I said, the community, the state, to the national level. And thanks to you folks, you're advocating for yourself and advocating for others, and that's what we need more of, so thank you.
Thank you, Scott. I want to thank our panelists for sharing your information, fielding some questions, and helping us to learn more about your organizations and who you're with and what you do. And this is what I am energized about tonight. I'm energized out of a question. We now have several folks who have volunteered to come together to begin working on how can we work towards having more landlords and addressing getting am I adding stuff onto your group and getting the business community involved? I might have just added some stuff. Also, I want to challenge everyone. We have this event once a quarter. We change it up a little bit. And what I would love for everyone here to do is look around, as you pointed out, sir, all of the seats that are empty in here. And I challenge each and every one to bring at least 3 people, make it 5 people who are different. A business member, if you're part of a faith community or a local civic group organization, your neighbor. Last time I brought my family and my mom's high school classmate. Like, bring folks so that they can learn and that we can grow. Out of tonight, we've also heard that there are some other things that will be good for us to look at as a coordinated effort that have not been brought into the conversation, or maybe not as much. Looking at racial disparities and also looking at the impact of stigma as well. So I really appreciate everyone for taking the time to come out tonight, for being able to speak up and share, and for hopefully learning something this evening. So thank you to everyone. Chief, you want to close this out in a word of encouragement?
I would just add this.
Third Thursday every month here at 1 o'clock. This group and anybody pretty much who's in blue tonight, that is who meets. We usually have anywhere from, sometimes we have as many as 50, sometimes we have 30, but third Thursday every month at 1 o'clock, we meet here. So please join us. The only way to make a difference is to be a part of it. So thank you so much. And thank you so much. Fabulous job as always. We can give everyone a round of applause. Appreciate y'all. Be safe. Great job, everybody.